aging population and a biomedical innovative surge have made total hip replacements the most prevalent procedures in the orthopedic industry. While they have the potential to cause relief to a patient, it comes at a high cost, including fees for imaging, consultation, and physical rehabilitation, just to name a few. Imagine yourself as a hip implant recipient, believing that your new implant would improve your life indefinitely, only to find out when you've just begun to heal from your procedure that the implant has failed. You need to undergo a revision procedure, reigniting the cycle of high costs and stress. These revisions occur in about 15% of patients within 20 years. Our solution will decrease the cost of standard hip replacements, but also will eliminate the cost and pain associated with having hip implant failure and undergoing revision surgery. Our solution combines an intraoperative scanner and analysis software to create and analyze a 3D model of the top of the femur, which yields an accurate femoral offset measurement. This allows the surgeon to select the most accurate implant size for a patient, eliminating the problem of premature implant failure. To accomplish this, we are forming a joint venture with the company 3Disc Americas to modify their current dental scanner for our application. Currently, preoperative templating is used along with trial and error methods. This not only lacks precision, but it also adds cost from x-rays, trial parts, and most importantly, surgical time. The industry standard technique produces femoral offset within 3.2 millimeters. However, testing our prototype consistently yielded an offset within 2 millimeters of accuracy.
Our market includes over 25,000 surgeons in 188 medical schools, which we plan to reach through trade shows, medical conferences, and in-hospital sales. This device will be sold as a base package of a scanner, a laptop, and our software for $5,000 with an annual subscription of $1,000. We project $30 million in sales and $6 million in annual revenue. The main revenue will come from annual subscription and the sale of replacement parts, especially the device tip. The tip is the portion that will be replaced after each procedure for sterilization. Given that each hospital performs an average of 200 procedures per day, more replacement tips will be purchased by each customer. Because the tip is based on 3Disc's existing scanner, a 510(k) submission will allow for FDA approval within 6 months, shortening our time to market to 1 year. The hip tip will improve patients' hip function and increase the life of their implant beyond 20 years, while reducing exposure to harmful radiation from pre-op imaging. Hospital networks and orthopedic surgeons can save time and cost of scheduling pre-op appointments and cut the revision rate from 15% to 5%. This reduction in appointment time and revision procedures will save insurance companies and patients $3.6 billion annually. In summary, the hip tip will revolutionize how surgeons determine femoral offset and greatly improve patients' hip mobility. Our team is asking you for $100,000 for equipment to continue with improving the color detection and to perform cadaver testing within the next 6 months in exchange for 5% royalties from device sales. Thank you.